Good afternoon, and welcome. I'm Dr. Marilyn Roderick, as most of you know, and this is the 5th week session of Coping with Coronavirus-19, a message of diligence and reassurance. Diligence meaning we're all doing what we know we need to do to prevent the spread of this virus, now called containment. Well, not now called, but containment is the epidemiologic term. And that we have formed an army from all over. I don't know how many or from wherever, but I know that someone from Ireland is on today, a couple people from the UK, one from Elizabeth from Nottingham in the Sherwood Forest, which I'm sure all of us remember from Robin Hood. And Australia is missing today because they're having the most important holiday in Australia, which is the commemoration of World War I, which I have to look up and find out more about. And all 50 states, including Alaska this week. And I would appreciate it if you would let me know you're here by messaging me in Facebook or emailing me on Zoom, which is Marilyn Roderick, M-A-R-I-L-Y-N, Roderick, R-O-D-E-R-I-C-K, M-D, at outlook.com if you're on Zoom, and also on LinkedIn if you could message me on LinkedIn. I'd really appreciate it so I would have some idea that you're all there and we're all together fighting this virus. Today I have a special guest that is going to talk about COVID-19 and the effects on the economy. He is Dr. James Smith, Jim, and he has a website which I put on your Zoom invitation, and I've also put it on Facebook. His website is Econ, capital E-C-O-N, Forecaster, capital F-O-R-E-C-A-S-T-O-R, and you'll get blogs on a regular basis to every time there's something important that he wants to say. He has over 30 years of experience as an economic forecaster. He has worked in various sectors of the economy, including an employee of the Board of Governors of the Federal Reserve System. He's one of President Reagan's Council of Economic Advisors. He's a professor of finance at UNC Chapel Hill, and I call it North Carolina's Harvard. It's very hard to get into. It looks like an Ivy League school on the campus, and it's just a wonderful place. Anyway, North Carolina's Harvard. And he's also been the director of business research at the University of Texas in Austin. He's also won several awards over the years for accuracy in economic forecasting. So it's going to be a very difficult topic, but if anyone can cover it, it's Jim Smith, Dr. Sim. So I'll have him come on and have me go away. And we'll try that for the first time doing that. Okay, so what do I do, Jillian? Can you turn your screen and audio on, Jim?
I should be on.
Okay, good. Okay, so how do we get rid of my screen?
You mute yourself. So
mute myself.
Mm-hmm.
Yeah, here it is over here.
All right, looking good. Well, as everybody knows, we are living in extremely unusual times. They're not really unprecedented. We had an earlier experience with the flu epidemic in 1918, 1919. That was far more virulent than the current situation, and we certainly hope that we never see another one like that. As Dr. Roderick has probably already told you, 1 out of every 3 people in the world got it. Some number between 50 and 75 million people died from it. 675,000 of those people in the US, and even worse, for reasons that I don't think anybody knows, it was a disease that targeted younger people. The median age was 28. COVID-19 is very different. It almost doesn't hit people under 21 at all. No cases of anyone below 10 or hardly any. And it's really deadly for people over age 65, and especially those with any other underlying chronic conditions, which is almost everybody over age 65 except a few really lucky people. So that's why we're all distancing. We either don't want to catch it or we don't want to give it to somebody should we happen to have it. Nobody knows what the economic impact is. I know you hear many, many estimates, but all they are is guesses because we haven't had this experience before in a time with good economic data. The limited economic data that we have from the 1918-19 epidemic is the US economy fell by 23%, like practically a quarter, which is very dramatic. And within 9 months from the beginning was back at all-time record levels. Officially, according to the National Bureau of Economic Research, a wonderful nonprofit organization that's about 80 years old, based in Cambridge, Mass., who tracks business cycles in the US. We had a 7-month-long recession followed by a very strong expansion. That's what many people expect to happen this time, although probably not such a long decline. Anybody who looks at the data knows in January and February, the US economy was doing extraordinarily well, by far the best performing economy in the entire world. China was already collapsing from its efforts to contain the coronavirus COVID-19 problems. In February, our unemployment rate was 3.5%. That means 965 out of every 1,000 people who were over age 16 or above and who wanted a job had one. Some of them had 2 or 3 or 4. And that we had not seen numbers that good since November and December of 1969. So we're at a 50-year high on the employment front. Total number of people employed, all-time records. Total personal income, all-time records. And the overall level of the economy, which is called the gross domestic product, or GDP, that's simply the value added of all the goods and services produced for final consumption, so it doesn't count inventories or intermediate goods, like all the parts that go into making the car or the SUV. Nominal GDP is GDP in current dollars. For the US, that's about 21 trillion right now. Well, not right now. It was 21 trillion in the fourth quarter of 2019. And we've been growing for 10 years and 8 months. The last recession ended in June 2009. It started in December 2007. That was the longest downturn since the Great Depression of 1929 to 1933. It didn't amount to much compared to that. During the Great Depression, nominal GDP fell by almost 49%. Real GDP, measured, adjusted for inflation, fell by 26.3%. That's the record for any downturn in the US since the start of business cycle data in December 1854. The recession of 2007-2009, peak to trough, was a downturn of about 4%. And we made that up in a couple of years by 2011. February was the 113th continuous month of employment growth. That, of course, was a record we had never seen since 1789 when the US started as a country. I should add that since we have somebody in Australia, Australia holds the current world's record for business cycle expansions. They haven't had a recession since 1991. So way to go, Aussies. Wish we could figure that out here. They attribute it to brilliant economic policies, both monetary run by the Royal Bank of Australia and fiscal run by the government. It also doesn't hurt to be the primary supplier of raw materials to the world's biggest consumer of them, namely China. But for whatever reason, Australia hasn't had a downturn since 1991. We've had 4 of them since then, and may well be in one now. We're certainly in a downturn, but what it winds up being called, nobody knows. So the US was in great shape to be hit with the coronavirus. China was until it was hit in January, and it was mostly shut down for Chinese New Year anyway. But now we know that in the first quarter, January, February, March, the Chinese economy fell 6.8% from a year earlier. That was their biggest decline since 1976, which of course Mao was still around, and they were suffering from the Cultural Revolution, a really bad idea. In any case, the US was in good shape. Europe was not in good shape. Europe, except for Germany and the Netherlands and Belgium, has never gotten overall economic activity back to where it was in the last peak, which was March 2008. So some economists say that Europe has been in a recession or a depression for 12 years now because they've never gotten back to where they are and have had unemployment more than double that in the United States. Now we're going to see absolutely awful data for the next 3 months on the US economy. It may be somewhat less awful than the consensus right now. Nobody really knows. What we do know is the government has done something that has never happened before. They're fighting the coronavirus in exactly, financially speaking, the same way we fought World War II. That was the last time we saw so many resources poured into a fight against a common enemy. The difference, of course, we could see that enemy and knew what it wanted to do to us. We can't see this one, and we don't think it's terribly sentient, even though it does morph into different types, as Dr. Roderick has explained to you already before. But we're spending over 10% of GDP. We've thrown $3 trillion, or are in the process of throwing $3 trillion into direct subsidies to individuals. Over 80% of people in the US, almost 90%, should have or will next week get a deposit in their bank account of $1,200 a person, $2,400 for a 2-person household, $500 for each child age 16 or less. Now, if the kid is under 1 or 2 years old, you won't get that payment until next year because the IRS didn't have you on your 2018 tax return, which is what they base these payments on for most people. That cost $290 billion, by the way. But the idea, and then on top of that, we have tried another idea that maybe isn't so bright. Well, here's the basic problem. A big survey done by the Federal Reserve Board, where, as Dr. Roderick told you once upon a time, I actually worked, and it's a wonderful institution in the United States. They do a survey of consumer finances every 3 years. And the last one they concluded in 2018 issued a press release, and they noted that 40% of all the households, there are about 110 million households in the US, so 44 million households, could not afford an emergency payment of $400. So that's kind of scary. That means that a lot of people who lost their jobs because their restaurant, movie theater, bar, or other business that the government shut down by mandate, nothing voluntary about it, lost more than $400 in the first week. So that was the reason for the $1,200 payment. And then there's a secondary one that's a $600 per week for 2 months, 8 weeks, payment from the federal government to people who are unemployed on top of whatever their state unemployment benefit is. Now, state unemployment benefits vary all over the board. North Carolina is one of the lowest. Mississippi, surprise, surprise, is the lowest. And Oregon, Massachusetts, Washington, New York, Illinois, and California are the highest. But that $600 on top of the payment, for many, on top of their regular unemployment, for many people is way more than they were making being employed. So we're finding already with small businesses who made it through the application and approval process for the first round of small business loans, payroll protection program loans, PPP, and now we have a second round that President Trump signed into law yesterday of $484 billion, with a big chunk of that going to pay small businesses. But the small businesses are finding when they try to bring people back, they say, but my salary is only half what I'm getting to be unemployed. Can I wait 8 weeks to come back? That's, I suppose, good for the individual, but it's not good for the economy. It's not good for the country, and it presents a problem. But it is what it is. So we'll see how that goes as we get farther along. Georgia's going to be the first state to experiment with reopening next week. We'll see how that goes. The key here, or at least to me the key, is we need, and we don't have, and no telling when we may have, a quick, accurate method for testing who has had the disease, who does have the disease, and who doesn't have it and has not had it. And I can see that many people are going to be hesitant to go to a restaurant, go to a bar, go to a concert venue or even church without there being a table or several tables outside where they take they prick your finger, or they put something on your forehead, or they do one of those swabs that apparently doesn't feel very good, and you wait no more than 5 minutes, and you get a green light, a yellow light, or a red light. A green light means go on in, you're safe. A yellow light says you better be careful, and a red light says go home and lock yourself in for 2 weeks. And I see Dr. Roderick disagrees, but she can comment on that very shortly. There's a lot of argument, what is the shape? We know we're going down right now in the US. China has seemed to come back pretty quickly. I don't see any reason that the US wouldn't do the same thing. We have this little bug about the $600 a month lasting for 8 weeks, but if they don't renew it, that's only an 8-week glitch. So we could have a peak in March, a trough in May or June, and be back to where we were by December or the first quarter of next year. On a technical point, nobody knows whether the National Bureau of Economic Research's business cycle dating committee, the accepted arbiter of business cycles, they've never had a recession shorter than 6 months. That was the one caused by President Carter's use of the Credit Control Act of 1969 in 1980, when millions of people cut up their credit cards and mailed them to the White House, and that was when the president knew he had a problem. If you scare consumers, you destroy the US economy. Personal consumption expenditures make up about 70%, 70, of GDP. So if consumers are happy, the economy is doing great. If consumers are not happy, the economy is not doing well. The $5 trillion question is, what will the people who got the $1,200 or $2,400 or more, if they have kids, payments, and the people with the $600 a week extra for 8 weeks, what will they do with the extra money? If they use it for rent, utilities, mortgage payments, car payments, credit card bills, or save to build up their savings because they're afraid what might come down the pike, then everything is lovely. We'll bounce back really quickly. If they spend it on discretionary purchases, we have a problem. If we've maintained income, but output is dramatically lower, then we have that classic situation of too much money chasing too few goods. That results in price increases, and that's called inflation, when the overall price level goes up significantly, and that's a problem. We had that in the 1970s. We paid a very high price. We had a steep recession in 1980 and a much steeper one and then a big recovery and then another recession in 1981, 1982, which until 2007 to 2009 was our worst recession since the Great Depression, or really since 1937, 38. So we're in uncharted waters, at least with pretty good data. All of the data on employment and income and hours worked and overall GDP, we get a GDP number for the first quarter, January, February, March, next Wednesday, April 29. So it'll be somewhere around 0 plus or minus. It won't be good, it won't be horrible, but the second quarter, which is now, April, May, June, we know is not going to provide good economic data. So stay safe, stay well. I think, did you want me to take questions now, Marilyn, or do you want to jump in? Yes, okay.
That'd be great.
So
Yeah, that'd be great.
any questions about the economic outlook, I will try to answer.
Well, I have one question.
All right.
How do you think it's going to work to get this 600, is it million or billion dollars back from publicly traded businesses that were supposed to go to small businesses? How do you think that's going to work to ask them to give it back?
Well, they're doing it. Ruth's Chris is giving theirs back. Shake Shack, I think it's a New York thing like Steak and Shake, which is what I'm familiar with. They gave that back. It's a tiny fraction of the overall 300 some odd billion that went out the door in a week. Now we have another almost 300 billion added to the pot. We'll see how long that lasts. Small business is the backbone of the U.S. We have, nobody knows for sure how many, but 8, 10, 12 million of them at least. And they employ about 52% of all the people employed, or they did in February. So you want to get small businesses back up and open, but there's also a demand side. Consumers have to be willing to shop. The Chinese government is proposing a very interesting concept called revenge shopping. Because you've been locked up in your house for 2 months, get out there and shop.
That's great.
The old mantra. So Jillian's going to do
Jillian's
that.
ready. She's ready for that. I bet my friend Janet Barger is also ready, right? She's watching on Facebook. Revenge shopping. So is
Right.
revenge shopping going to be good or bad? Because it sounds like it's going to be bad.
Well, it'll be good after everything is open again. What you don't want it when nobody can buy stuff. The only other time, as I said, we've had this stimulus was in World War II. Well, there wasn't anything to buy. Almost all of civilian production was converted to military production. You couldn't buy a new car or truck because there weren't any. From the 1941 model year until 1946, everything that the auto producers made was a tank or a Jeep or a deuce-and-a-half truck. They didn't make anything for civilian goods. And same with consumer durables. Whirlpool was making things for the military, and Frigidaire was not things for consumers. Plus, we had wage and price controls, so prices exploded. After the war was over, controls went off, and it took a while to ramp up production. And we had, for the U.S., relatively high inflation. So that's a concern. Well, there's another concern, of course. The budget deficit is just completely blown out the window. Congressional Budget Office yesterday told us, expect about 3.8 trillion. They're just guessing. Everybody's guessing. I believe it'll be over 4 trillion, maybe over 5. That's bigger than the whole economy was 40 years ago. So nobody knows. Yeah, well, I know it's amazing, but hardly. We want to take care of those people who can't afford the $400. That's the real, on a bipartisan basis. That's not a Democrat issue or a Republican issue. Nobody wants to see people in the United States starving, and much less children in those families. So, but you want a temporary income support until they can go back to work. And if they can start going back to work in May, June, July, that's great. But nobody knows when we'll get safe, efficient, effective testing. And until that happens, I don't think there's going to be, sure, people are already going to the beaches in Florida where they've reopened the beaches, and in California where they don't seem to understand social distancing at the beach. I don't know if you saw the one the other day. The Florida beaches open. The police went to the beach to make sure people were maintaining social distancing, and they saw some genius in an American flag swimsuit who they'd all just gotten on wanted posters from Pennsylvania at every police station on the East Coast.
You're kidding.
So he's in jail waiting. He murdered somebody in Pennsylvania, went to the beach in Florida. So, well, allegedly murdered somebody, I should say. Innocent until proven guilty, but not a rocket scientist, that man. But everybody wants to get out of their house and do something. I'm not sure. We may see Major League Baseball have a season, but there won't be, the only fans in the stands will be pitchers who aren't pitching that day and the office staff.
Exactly.
Yeah, well, I don't know if you've seen the beautiful experiment where 27 Major League Baseball teams and all their employees, from the Cracker Jack and beer vendors to the owners, are in a trial to be all 10,000 people being tested, run by a viral immunologist who's normal with your alma mater, Stanford and USC. They found a source of approved for testing in Michigan, I think, that only had 15,000 test kits. And this doctor who normally tests ball players, or his group organization does, for steroids or whatever, illegal, but since nobody's playing baseball, they're not testing. He said, I'm going to go back and use my original training in viral immunology, sounds like some lady I can see on my screen, and saying, why don't we do this? So he knew the drug company and he knew the folks at Stanford and USC, and as long as you kept the numbers below 15,000, they're doing 100% testing. And,
That's great.
Yeah, so that could result in getting a baseball season going, but with nobody outside of those 10,000 people, and that's 10,000 people spread over 27 teams. But we'll see. I mean, nobody knows. You see Spain.
I have one question, Dr. Smith.
Right.
So, especially with me as far as retail, do you think that after people have gotten used to shopping online, that they'll be willing to go back into stores to go shopping?
I have never met anyone who didn't prefer trying on clothes before and buying in person. There's some things you can perfectly happily buy online. I mean, I've been surprised at how well online automobile buying or even house buying has been going. But some retailers who are already in trouble or may not make it, but the soft goods, clothing in particular, and apparel and accessories, people want to see, how do I look in that dress, or how does that suit really fit? And they won't go, but online shopping is only up to about 12% of total retail, maybe 13 now. But there's plenty of room, Jillian. You have a great career ahead.
I have something to say about antibody testing. So far, the FDA has approved of 2 antibody tests. Both of them test for IgM, which is the antibody that you get immediately when you're sick. It's the acute phase antibody. Yesterday, Abbott announced that it had an antibody test for IgG, which is what you get after you've had the infection. And that would be really important as far as testing who is safe and who is not safe. And they've shipped 20 million doses to some place that they didn't say exactly, but where they're going to be doing this testing of this IgG antibody. And they're able to do it. There's something in the FDA for emergency use of doing these things, and so that's going on right now, and that would be the important thing. But all of these tests involve taking blood somehow or other, even if it involves pricking your finger, but it involves taking blood. And I don't know, but I suspect that it can't be done instantaneously so far. I don't know of any antibody test that can be done that is, the result is available right on the spot. So that's why I was shaking my head so vigorously when you said, oh, you'll get it and you'll know whether you should go into the church or stay out of the church. So that would be that would be a wonderful fantasy that we all can keep hold of.
Marilyn, I have one question for Dr. Smith, if I may. Dr. Smith, you mentioned
My Aunt Jeanette in California.
Okay.
You mentioned ways that people would spend their $1,200 that would be beneficial to the economy. And then you said discretionary spending.
Normal, Your basic bills, your groceries, your rent or mortgage payment, your gas, electric, water, internet, TV, if you're with Dish or Direct or Hulu or however you get TV, basic clothing. Discretionary would be if your old vehicle is still running, buying a new one. If your washing machine is still going along, getting a new one. If it breaks and you replace it, that's not. But I've already seen, people, booking. Apparently, there's an enormous pent-up demand to go on a cruise. I don't know why. So people are spending money booking cruises, which can't go anywhere until July at the earliest. That's okay, but there are things where we know where there's not a big supply of goods, and so excess demand is just going to drive up the price. Things.
And that's inflation increasing.
Yeah, well, it could be. It could be. Too much money chasing too few goods. If a lot of people want to buy fancy clothes and there's not enough shops open, the inventory is there, but you can't get it all online. That's going to result. Look at the problems Amazon has had policing price increases with its third-party vendors. That's the kind of thing that you have to worry about because the money supply is growing like a weed. The Federal Reserve has ramped up its balance sheet. Was already almost $4 trillion. Now it's about $7 trillion, and they're monetizing our debt. They can create money out of thin air perfectly legally. That's what central banks do. It's not just our central bank, the Bank of England or the European Central Bank or the Bank of Japan have been doing it for a very long time. We, until recently, had been pretty cautious. The Federal Reserve had been, but it's we're not just throwing in the kitchen sink, we're throwing everybody's kitchen sinks, and probably the ones out of all the military bases as well. I laughed, I heard a presentation the other day about some vaccine, I don't know what it is, that's being tested at Fort Detrick, Maryland, which, as you know, is where the military does all their testing for chemical and biological warfare. The U.S. doesn't do anything with biological warfare. They figured out a long time ago you can't avoid infecting yourself, so why? That's kind of a stupid kind of warfare. But in any case, they had 2 volunteers, as the guy giving the presentation said, probably 2 privates whose sergeant said, roll up your sleeve, you're getting a vaccine. And after 2 days, they hadn't died. So that they thought was successful. Don't think you really want to line up for that shot, just saying. But, that's an example of, I can't imagine anybody with experience in this field, in all the fields that are involved, with successfully combating COVID-19, who's not working as part of a group going around the clock 24/7. I just can't imagine.
That is true. We have a question from, can you say, Jillian, the question?
Sure.
It's from Deb McGuire Day.
It says, do you think it is realistic to consider this COVID lifestyle continuing until we receive enough vaccines for the entire U.S. population?
No, is the short answer. Again, Dr. Roderick will have a better answer, but enough vaccine. It's not just the US population, it's the $7 trillion in the whole world. You can't shut our borders forever. We have to have, the plant manager for General Motors in Shanghai once in a while has to come back to Detroit and see what it is that's new and how it's working in some factory in Michigan or Alabama or there are no vehicle manufacturing in North Carolina factories. But in any case, no, we won't be waiting on a vaccine. The other side, but testing. I don't see large numbers of members of AARP or people who are qualified, at least 65 and above, people being very freewheeling about where they go and what they do until there's a good test. Yes, N95 masks are nice if we get production ramped up enough. We don't have enough of those for emergency workers, much less for the general populace to use. We're so far behind, and I say we, I mean globally we. There is no maybe a very small country like Luxembourg or Monaco or the Vatican or Vatican Cities, its official name. But people are going to be cautious. Now, there are some bright sides. Automobile accidents are way down. They're down so far that almost every vehicle insurance company is either sending you a check or giving you a nice rebate, which will show up on your next bill whenever your policy renews. That's a nice thing. And while we're all focused on how many deaths from COVID-19, I think we're up to 50,000 now. Remember, in the United States, on an average day, 5,000 people die anyway. Well, 10 days, that's 50,000. So some of these are replacing, some of these people dying of COVID-19 would have died from something else. And by the way, there's a brand new website, pandemiccosts.com, that's calculated that the total costs now are up to, as of Friday, in the US, $8,111 per household. So your household has already spent $8,111 fighting COVID-19. That's kind of a big eye opener. It's run by a very highly regarded economist from the University of Chicago named Casey Mulligan. But that's pandemic costs, all smooched together, .com. It's updated, but I don't know if it's updated on the weekend, but it's certainly updated every weekday. And we've spent about, something over 4 trillion, which is about 13-14% of GDP. And you didn't see numbers like that, nor like the current deficit in relation to GDP. We haven't seen that since 1942, 43, and 44. And we knew the enemy then. We knew what we were fighting. We know what the enemy is now, but without a pretty high-powered microscope, we can't see it. We know how it works. We know how it spreads. We know how it mutates. We don't even know. We do know it's very contagious, but we don't know how fatal it is, because we don't know how many people have had it. We know we're undercounting that. We're probably dramatically undercounting how many people have died from it too. So we're really in the dark here, we globally. It's not like they have better data in Canada or in Italy it's a global problem. It's not going away anytime soon. But I think the U.S. is probably, economically speaking, in better shape than most other. Canada's even better because Canada's debt to GDP ratio was much lower than the U.S. before it started spending money. We've had profligate people in Washington, D.C. for the last 20 years. We haven't seen a budget surplus since 2000 or 2001. So we
Was that Bill
were
Clinton? Was that
Yeah.
Bill Clinton?
It was the first President Bush, and the Democrats in Congress cut a deal toward the end of his administration to raise taxes and stop spending growth to a big degree. And then President Clinton got the benefit. But they were huge budget surpluses, $1 or $2 trillion. And some very foolish people were concerned, well, what if there's no government debt left for the Federal Reserve to buy for their open market operations? Well, we solved that problem in spades.
Wow. Well, Jim, I think we could talk to you for a week about this, but might have you back on a later time to give us another update, maybe when we even have more information about what is happening. I think that that your message that we're in the dark and the whole world is in the dark is really pretty much sum it up for right now. And I think that all of us know that in order to contain the spread of this virus, we have to follow our orders to stay home, even in states like North Carolina, which is number 5 out of the 25 worst ones, and it's number 25 out of 25. And the governor has just extended the order, and you're in North Carolina too, I know that, in Asheville. So the governor has just extended the stay-at-home orders for another week. It was supposed to be done at the end of April, and now he's extended it to May 8th, just to see what's happening with these other states that are starting to open up now, and he's being extra careful, which I actually appreciate. I just had a call from my dog's groomer. Was I going to be keeping my appointment for the dog to get to the groomer on Monday morning? And I said, I thought you were closed. And she said, oh, no, we've been open for a couple of weeks now. I said, well, I think I'm going to have to abide by our governor's order to stay home. And thank you very much. We'll see you later on. And goodbye. But there are people like that all over, we know. And we just have to try to hold strong and keep doing what we've been doing, because it seems to be working. Even in New York, it's working. I see my cousin Frank Hodgkinson is on it. His 3 children live in New York City. And he and Kathy, his wife, went to visit them and stood outside of their apartments, all 3 of them, to be able to say hi to them and give them a virtual hug. So that's what's going on in New York. And so I'll leave it at that now, Jim, and we thank you so much. And I'll probably ask you questions later on.
Thank you, Dr. Smith.
Now. Yeah.
You're more than welcome.
Appreciate it, and I'll say aloha.
Aloha.
Bye-bye.
Bye.
Unmute. Yeah. Oh yeah. Okay. Okay. So it's 8 minutes to 3, and so I don't want to keep people a long time. So I'm just going to summarize what I was going to say and give you a couple highlights without taking a long time. As we've talked about, our death rate actually was 79 deaths per million last week when I talked to you, and this week it's 152 deaths per million. So so I'm not sure exactly what that means as far as the curve going down, but we'll just have to keep an eye on things. And the U.S. has multiple other countries that are worse than we are, as I mentioned last week, and they're still worse than we are. And we'll see what's happening with opening our beaches here in North Carolina, in the southern part of North Carolina, A few are starting to open, and some are opening with, well, all are opening with no public parking at the beaches, and some are open just to residents, and the others are not open just to residents, but they want to see what happens. And our beaches near us have decided to stay closed until they see what happens with the other beaches that are willing to open right now. So I'll just review the source of this. The source of the infection is human lungs. Human lungs and respiratory secretion, saliva, sputum, mostly lungs. And that fomites, F-O-M-I-T-E-S, as we've talked about before, the virus can last for up to 3 days. That's the maximum amount of time on fomites. So it's really a very minor part of how this virus is spread, fomites. So for people to stay safe, this is what's been said all along, that you need to shelter in place, stay home. Don't go to the, I don't want to use my mother again, but don't go out to buy unessential things. And if you're old, try to have somebody younger go out and buy it for you, even to the grocery store. If someone's younger who can do it and will do it, then that's what you ought to do. Don't touch your face, don't touch your eyes, don't touch your nose. And the recommendation is to wipe, this is if you go out, the recommendation is to wipe frequently touched surfaces like doorknobs, the computer, your cell phone, things that you touch frequently. And I'm just going to mention that President Trump yesterday talked about injecting people with bleach or swallowing bleach or things like that. All of you know, I'm sure all of you know, but I'm just making sure that that is not really a realistic proposal. And he says so himself. So please ignore that. Okay, and then the other thing I'm going to say that's important is that the NIH just yesterday came out with guidelines, and they got a group of expert people in different areas about this to cogitate and really think and talk about how to make these guidelines for different aspects of the COVID epidemic. And so they're all, I will put the guidelines, how to find them, on my Zoom website and on my Facebook website and on my LinkedIn website, so that you'll see where those guidelines are. And it's really helpful, and it's important to look at those before you look at anything else. What I've been saying all along is when you hear things, you say, well, what is the source? First of all, what is the source? Is it somebody who knows what they're talking about, or is it somebody who really doesn't know and is talking about anecdotal findings? Anecdotal meaning incidental and not really able to be counted as verified. And then the other thing that people have been talking about this week is, can people get reinfected with the COVID virus? And the answer to that is probably no. Probably the tests in South Korea that were positive after the people were tested negative are the remnants, R-E-M-N-A-N-T-S, the remnants of the virus. It's a very sensitive test, so the remnants are showing up as a positive test. But when they actually tried to grow the actual virus, they were not able to grow it from the sputum of these people that had tested positive. So you probably cannot get it again. I'm saying probably because who really knows? But as far as I can see, you're not going to get it again. And then wearing cloth masks when you go out don't wear the mask when you go out to walk in the park and you're keeping a distance. You want to be able to see it and smell the flowers. You can still do that. And you wear the mask only when you're going to be within 6 feet of other people at the grocery store or at the doctor's office. And remember, you're wearing the mask mainly to protect others from you in case you have COVID disease yourself. You're keeping the COVID to yourself, so to speak, with this cloth mask that's on your face. And then the last thing is that the vaccine, as Jim was saying, it's still going to be a year to year and a half before the vaccines are available. And there are 25 different tests for 25 different vaccines that are going on last week, and now I don't know how many more there are. So we will not be seeing vaccine in time to really reopen or go back to anywhere near a normal state of going outside and around others. So it's going to take time. It is. It's almost difficult. It's very difficult. It's almost impossible to say. We just have to keep doing what we're doing. But it's working and it's containing the virus. But as soon as we start to go out, we'll see what happens in Georgia. And let them be the test case. But everybody else keep staying home, please. And the mayor of Atlanta was interviewed extensively about this, and she is against it. She said her city, Atlanta, and the second city in Georgia, that are the two most populous cities, the mayors were not consulted before the governor decided to do this. So it's done without their consent and without their involvement or opinion at all. Next week, I'd like to talk about the importance of contact tracing, which we've not really talked about before in epidemiology. How important the tracing of people when they are COVID positive, to try to think about everybody that they've been exposed to, and then try to get back to all of those people. And we'll talk in more detail about that because it's an amazing aspect of this epidemiologic quandary that we're in. And so we'll talk about that next week, as well as new information about each of the aspects that we normally talk about. And so I would like to have a self-help exercise, but if for people that don't want to stay or cannot stay for the self-help exercise, then I'm going to say aloha now. And when I lived in Hawaii for most of the 10 years prior to now, well, it's probably 15 years before now. No, it's 10 years before now. But I lived there back and forth on 2 islands for 10 years, and I loved saying aloha to people. It was so, it's a great word. It almost has onomatopoeia, where the word sounds like what it means. Aloha, it's in the Hawaiian language, which is a very soft and quiet and peaceful language. It's used to say hello, and it's used to say goodbye, and it also means I love you. So I'll say aloha, and then I'll ask people who are willing and able to stay for the self-help exercise, which to me is so important that we're doing this. We should be doing this self-help exercise twice a day, every day. And it takes about a half an hour, but it's a half an hour out of 48 half hours in a day. You should use to really help yourself so that you're stronger, so they're able to help others. So I'll say aloha to some, and for others, welcome to the self-help exercise. So the first part of this, it's got 3 parts. One is guided imagery, which I will tell you how to do, and it will help you relax your body. The second part is we're going to meditate on the word love. There are various ways of meditating, but it's usually on a Sanskrit word or some kind of other special word. But we've chosen the word love to meditate on. And then the last part of it, part 3, is asking for help from your higher power. And this means anybody that you pray to. For we Christians, for us Christians, it is God, Jesus. For Jewish people, it's God. For other people in the Southeast, in the Middle East, it's Allah, it's Muslims, it's people that have another higher power, but almost always those higher powers want to have people be peaceful, want to have people love each other, want to have people be kind to one another and show loving kindness. So it's all inclusive, this last part. So go to a place that is quiet and that is where you won't be interrupted. Lock your dog as we have outside our door, and close your eyes. And we'll start with your toes. Have your toes relax. Wiggle them in a slow, gentle way until they're relaxed on your feet. Next is to relax your actual foot. Once again, sit in a quiet position. You can sit with your hands on your lap. Your eyes should be closed. You can sit on the floor position of what's normally used in meditation, with your legs crossed, your hands open and on your knees. Next is relax your ankles. Relax your ankles. Move your ankles around to the point where your whole foot now is in relaxation. Your lower legs, your calves. The padding in your calves is gone now. Now your shins, the front of your legs. The ones that ache when you're getting lots of exercise are now relaxed. Move up toward your knees. All those painful knees are now relaxing because they don't need to bear any weight on them. Now your thighs, your quadriceps muscles, the front part of your thighs, tell them it's time to relax. They don't need to do anything right now. The back part of your thighs, again, the ones that hold you up, let them relax too. Tell them it's time to relax. Your hips, all those hips that can be sore, are now relaxing. Now to your abdomen. Your abdomen, it's time to relax. Your organs inside your abdomen are also relaxing. Your stomach, your bowels, your liver, your pancreas, your spleen, your large intestine, your small intestine. No reason to tense up for any of those organs. Then move up to your diaphragm, which helps you breathe in and out. Take slow breaths in and quick breaths out. Count to 5 on the way in as you're breathing, and perhaps 3 on the way out. Slowly in and out. Your lungs, which are the key things that can get infected from this COVID-19 virus, SARS-CoV-2 virus. Your lungs are relaxed, getting plenty of air, breathing slowly and easily. Your back, your lower back, the part that's always hurting when you walk too long or stand too long or even sit too long, the lower part of your back, lumbosacral area is now relaxed. Now move up to your shoulders. Move your shoulders forward and back a few times each way. Help them relax. Now move up to your neck. Your neck, move your head to the left and right very slowly. Get those neck muscles to relax. Now move up to your face, your chin. Let your chin hang down. Let your cheeks hang down. Let your lips hang down. Move up to your eyes. Tell them it's okay just to be using just your mind's eye to see. Mind's eye is very important. Now move up to your head, your scalp, your hair. Now consider your entire body as one very peaceful, relaxed state. Now we'll go on to meditation. For meditation, we're going to be using the word love. And here's the pace we say it at normally. Anywhere about this pace. Love. 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 As you say these words, thoughts will come into your mind, with your mind's eye. Just let them go right on through. So don't focus on the thoughts, just let them go right through. And come back to the word love. You're meditating on the word love. I'm going to take a few minutes just to do this. To help you experience how powerful the relaxation is, how powerful the meditation is. If you do this regularly, you'll only be able to do it a few minutes at first, but you will work up to 20 minutes. When you get to the 20-minute mark, you'll be able to see different colors, orange and red, in your mind's eye as you meditate, as you get deeper into meditation. Okay, now we'll conclude with part 3 of the self-help exercise, which is asking for help. This is a time to pray to whomever or whatever is your higher power. We all need help fighting this COVID virus. We need psychological help, which is becoming more and more necessary as we stay in and shelter in place. We pray for help. This is where we extend our loving kindness, our compassion to our fellow warriors in this army, to the frontline workers in New York City, Chicago, and every single state that are taking care of these COVID patients and risking their lives to help us. They are going to work so that we can stay home. Our entire United States. And now please, if you will, extend that loving kindness to other countries, to Africa, to Korea, to China, to Australia, to Ireland, to England. And I'll see you next week. And for now, I'll say aloha.